Welcome to your medical unit huddle for January 24th through the 31st. I'm Ricky, your nurse manager. First, I want to say kudos to everybody. Our quality measures are looking pretty good. We're starting to improve quite a bit. And I don't know the exact date, but it's been quite a while since we've had a fall, knock on wood. Anyway, I wanted to thank you guys for that and continuing to make sure that our patients are safe, that they're communicated with, making sure that the whiteboards are up to date, making sure that's the first thing you do when you go into a patient room, of course, besides washing your hands and sanitizing and saying hello to your patient, but making sure that the whiteboards are up to date with who their care provider is and what their plan of care is for the day. That's super important for them to be communicated with. I did want to mention though that with our pain scores, I did get the updated ones for the last week. We did dip a little bit. Overall, we were right around 89%. Now we're back down to 81. So just making sure that we are documenting and asking our patients at least within 6 hours of admission, and of course every 4 hours, whether it is with the assessment, and of course 1 hour after any type of intervention. You guys know what to do. Another thing that had come up is I'm sure that there's been a few rumors, at least in the last couple of months, it was kind of going around that there was going to be some random drug testing. That was trialed down, let's see, where was that pilot program with the surgical techs. And so they've kind of have started to wrap that up, and it will actually go live house-wide on January 30th, that anyone who is kind of like a direct patient care person, or in what they call a safety sensitive position, they will be subject to, if you will, random drug testing. No, it doesn't include THC or alcohol, but basically anyone who would be near narcotics or that kind of thing. Basically what it is we want to ensure the safety of our patients, and really if you need some more information on that, you can check out the source. Also, a couple of things that had come up from the practice council. Again, just kind of making sure that we're, I don't know if we want to do like a vitals tower roundup when we're kind of wrapping up our shift, when we're making sure that the trash is empty and the rooms are tidy, that kind of things, that we're actually looking to see if there's any random vitals towers that are in the room. It takes a few seconds, folks, to get those out of there, get them cleaned up, and to their assigned location. So something to think about there. Also, was brought up about doing a buddy system again, that when you're wanting to take a break or lunches, that you're picking a buddy at the beginning of your shift. I don't know that it has to be anything formal, but it was brought up as a good idea, and the practice council has decided that if somebody from the practice council is on, that they're going to try to really push that, just to make sure that we are getting adequate breaks and lunches and that kind of thing, because it's stressful out there. Also, good news that the CSC pay that was approved the last couple of weeks was such a hit, and was just great all around for staffing and making sure that our patients are taken care of, number one. They have decided to extend that to February 7th. So we would ideally like to have at least 1 or 2 over in our staffing, just because we're still having a high volume census overall house-wide and with some sick calls. So definitely check out that needs list and sign up. If there's any shifts that you know that you'd be able to help out with, of course that's always appreciated. Staffing, we do have I think a couple more folks that are starting orientation, so yay. And then there are a couple of positions that are posted, doing some interviews this week. So again, we're always striving, we're always getting there. If there's any real quality things to cover with patients, high falls, drips, seawalls, whatever, I'm going to turn that over to your charge nurse. You guys have a great shift. Thanks for all you do.